Thank you, Debbie. So, my name is Sally Lindsley, and I am one of the account managers here at Navia. And sorry, I'm just getting my screen share up. Okay. Apologies, I'm on a single monitor today. Um, so, we are, myself and Christy Gates, we are both account managers at Navia for the PEB and sub plans. And we are going to do a walkthrough for you all today, showing you the features of the new Navia Employer Portal. So, what is changing? PEB benefits administrators who currently work with Navia on the FSA and DCAP benefits are going to gain limited access to Navia's employer web portal starting on Tuesday, July 23rd. Through this portal, you're going to be able to securely upload member forms to enroll, change status, or terminate coverage. So, starting on the 23rd of July, you all will be able to, those enrollment forms that you collect from employees when they want to sign up for the FSC or DCAP, make changes mid-year or terminating, you can now upload those through our online portal. So the first step to gain access to the portal is registering with Azure. Now, some of you may actually have access to this already, but there is a group of you who need guest user access. And if you are one of those folks who needs the guest user registration and you don't already have an account, you're going to receive an email. On my screen right now, you can see a screenshot of the email you're going to receive. It's going to come from Kyle Wisdom at HCA, and it's going to be an invite for you to register an account. So you can see that there is a accept invitation link down at the bottom of the email, and you will click that, and it will take you to this next page where you're going to need to click the accept button here. It'll look just like this with the Washington State Executive Branch agencies. Um, Click that accept invitation button, and then you will need to log into your Azure account or create one. It will send a request to have an email sent to you, and then you can enter that code and it will get you registered. So you are going to receive this notification. If you don't already have an Azure account, you're going to receive it on July 19th or the 22nd. So that's a Friday or the Monday before things go live on Tuesday, the 23rd. And you know what? I'm going to pause just for a second. I realize I kind of jumped right into the presentation. Just want to clarify too that my colleague Christy, she is monitoring the chat. She's monitoring your questions. I'm just going to run through my presentation, and then once we get to the end, she'll kind of, if she's not able to answer any questions for you in the chat, she'll kind of read them to me at the end, and we will address those once we're done with the presentation. Okay, so going back, registering. So once you have registered with Azure and you have that all set up, you've got your Azure account squared away, you then need to register on the Navia side. And how you do that is you go to the PEB Navia website, which is the URL for that is peb.naviabenefits.com. And once you go to the page, we've got two screenshots here of what it looks like. You'll just see the kind of main Welcome to Navia homepage screen. In the upper right-hand corner, there's a red button. It says Login. You're just going to click on that button, and then it will take you to another page. And on that next page, you will see that there is a button in kind of the center left of your screen that says Benefits Admin Login. So that is what you are going to click on, and that will take you to the next step. So after you click that Benefits Admin Login button, you may be prompted to enter your username, which is from Azure, so your email address and password that was created when you clicked on that guest invite link for HCA or whatever you had done previously to set up your Azure account. Once you've clicked that, you're going to be prompted to set up multi-factor authentication. Again, if you don't already have that set up on your Azure account. So if it's your first login, it's going to ask you to do this. You just want to follow the prompts on the page. It's going to look like the screenshots over here on the right. You have a few options for setting up your preferred MFA method. We recommend Microsoft Authenticator, but you do have some other options. And if you do pick, I want to select a different method, you will see this kind of this little drop menu that gives you some other choices. Once you have finished, you'll just want to click next after you you set up you choose your authenticator method, whether it's Microsoft, excuse me, authenticator or a different method, and it will take you to this next screen, and you will probably be prompted to actually enter your MFA code or complete the MFA, however you've chosen to set that up. And once you've done that, you will be logged in, and you are going to see this screen down here, kind of towards the bottom right. It'll say Navia, welcome, your name, Washington State PEB, and you'll see, yeah, some various things on your screen. So you may run into some error messages as you're registering, and essentially there's two error messages you may see, and I've got both examples up here over to the right. So if you get this one, this screen here that says, sorry, but we're having trouble signing you in, it's kind of these two white boxes, and it will have a kind of a nice background. That's basically a sign that you're having an error on the MFA or Azure side. So if you run into this error, what you need to do is contact ONT for assistance through HCA support, and you want to make sure to select the Benefits Administrator inquiry tile when you go to that website, or alternatively, you can call the 1-800-700-1555 number on the screen. You may also just get a plain kind of white page that just has a simple error, like line of text at the top. It looks like this here where it says unknown user, please have your employer contact Navia Benefits and reference error code, and it'll give you some numbers. If you do get this message, that is a Navia side error, and you want to contact us at ESTeam number 4 at naviabenefits.com. So once you've made it into the portal, what are you going to do? Well, what you can do in this portal now is submit forms to us. So it's a secure repository. It's totally encrypted for submitting FSA and DCAP forms to Navia to enroll, change enrollment, or end enrollment. So it is going to increase the successful transmission of forms. You don't have to worry about, failed faxes or emails not making it through for some reason. It will definitely create a much better workflow and ensure enrollments are making it through and getting entered timely. It is, like I mentioned before, also totally secure. It's encrypted. There's just no need to worry about security concerns when you're sending in those forms. We Employers should be using the portal for all form submission, both during the annual open enrollment period. So this is if a employee gives you their open enrollment form, and just also throughout the plan year when you have new hires coming on, you have people having a qualifying event that gives them a special open enrollment to make changes, or submitting even terminations. So you no longer need to fax or email or even snail mail forms to Navia. You can use this portal instead. Also, just want to clarify that there is not going to actually be any changes to the forms themselves, how they're completed or collected or signed. That process is staying totally the same. Whenever your employees need to make a change, essentially outside of open enrollment, they need to fill out the appropriate form, turn it into you. You'll review, if approved, sign it, and then submit it to Navia, and we'll get it processed. This is really just a new method for you guys to actually get the forms to Navia in a secure and timely fashion. So how do you do the upload? Once you follow the previous steps to register and log in, over on the left-hand side of the screen, there's kind of a black bar, and there is a few options that you're going to have. And the first thing you're going to want to do is click on the data management. It's going to not completely refresh the page. It's going to just kind of swap it out for another menu. And from that menu, you want to select Send File. Once you click on the next screen, there's going to be a location. Sorry, it's kind of split funny on the slides, but this is what it looks like, where you can, sorry everyone, I clicked ahead too far. Let's see here. All right, so, and it'll essentially allow you to just drag and drop the forms or any files you're trying to upload to us into the section or onto that page. So yeah, just again, back to the screen, you can see that this is the send file link you would click on. It will bring up this screen here, and there's this box where you can just drag and drop any files you have. You may also click that choose file link right here, and that will prompt you to, it'll bring up a window that lets you select a file from your computer if that's what you would prefer. Once you load the file there's a few options on the right to the box. There's two drop menus and a text box. The only thing that you need to fill out over there is the first drop menu where it says file description. And there's a few options in this drop menu, but you want to select the first one that is called enrollment, change in status, or termination form. That is the only category that you need to pick. Don't worry about the other ones. The other drop menu is a file recipient menu. It's not required. I recommend you leave it blank. It doesn't hurt anything if you accidentally do select a name from that list, but it's just easier to leave it blank. And then lastly, there's a comment box, and you're welcome to add a comment along with your file, but again, it is not required. And I actually do want to show you guys this live because I know the screenshots are not the best, so apologies here. So I'm just going to kind of start from the top. This is the home page that you would go into to begin the process.
Hey,
On the
Sally,
left hand, oh,
we're
did my
not
screen
seeing,
share stop?
yeah, we're not
Oh,
seeing
okay.
the website. Also, we've been getting a lot of
Okay.
questions about will we be providing the slide deck to the participants? And yes, we will.
Okay. Here, let me see if I can get all right, I apologize. I think I only shared the oh, let me see if I can share my whole window. Okay, here we go. All right. Can you guys see the website? Can you see it on your
Yep,
screen,
it's
Christy?
now.
Good. Okay.
Yep. Thank you.
Awesome. Thank you. Yeah, sorry everyone. I'm down. I'm only working on one monitor, so it's a little difficult for me to see. Um, so this is what the homepage is going to look like. You'll see some, options here. You don't need to worry about really anything on the homepage. All you need to do is go over to this left side menu, go over to data management, and down here it says send file. And I will say too that my login has some more access that you all basically won't see as many options on your screen. So it'll be a little bit more straightforward. But once you get to the send file, you will see the drag and drop. So you can just take any file on it saved on your desktop or in a folder, drag it in, um, or you can do the choose a file and you can go this route as well. This is the file description Dropbox I was telling you guys about. This is the option you want to select here, enrollment, change in status, or termination form. Leave file recipient blank. And then notes, you can add a note here if you'd like. It generally will be seen by our elections team who processes the forms. But again, not required. You're totally fine to leave it blank. Okay, and now I need to, apologies, I need to change what screen I'm sharing. All right. And I lost my mouse. Oh my goodness. Okay. All right, so that is the upload. So once you've hit send to upload the file, once you have all of that filled out, I apologize, I should have shown you there is a button there that's at the bottom, towards the bottom right. It says send. You click on that. Once you have, again, everything filled out, you have your file dropped in that little window, it will send the file and you will actually see a little green message pop up. It says file sent successfully. It's down in the screenshot below. Um, and that will basically confirm for you that the file has been successfully sent. You will also, in addition to that, receive an email notification that confirms that your file upload was successful. It's going to come from notification@naviabenefits.com. And it looks like, again, kind of lower right of the PowerPoint, there is a just example email of kind of what it's going to look like. It'll say file uploaded. So if you get that email confirm, safe to say the upload was successful. If you don't get a confirm, that's a sign the upload may not have gone through. So I do recommend reaching out to our team. I'll give you the contact info in a second, but if you want to just confirm 100%, you're always welcome to send us just a quick email to be like, hey, I uploaded a file. Can you make sure it went through? You can also just try uploading it again, but you should be getting that notification. Okay, so we put together kind of some questions that we anticipate uh, you guys might have. Oh, sorry about that. Okay, here we go on the right slide. Um, just kind of normal things that have come up in the past when we've rolled out the portal. Uh, So when will registration go live? Uh, it's going to go live on Tuesday, July 23rd. Can you have more than one user per employer, agency, university? Yes, you can. However, we do request that you limit it to three contacts per your agency, just so for security and kind of keeping things not getting too overwhelming. Um, so how do you set up access for a new user or remove access if someone maybe leaves your agency or just changes roles and doesn't need that access anymore? So to do both of those, to do either of those things, you're going to want to reach out to both Navia and HCA and request that we do that. So for Navia, you just want to send an email to the EST team4 at naviabenefits.com email address. For HCA, you want to send a secure message through HCA support or call that 1-800-700-1555 number. Um, can you upload multiple forms at the same time? The answer to that is yes. You can actually upload multiple documents. You can also, of course, make a single PDF file with multiple forms if you want, but if you have multiple separate PDF files or whatever format you're sending it in, you can upload those. You can drag and drop a few different things at the same time. It just has to be under the 10 megabyte file limit. Um, will employees still be able to enroll on the Navia website during open enrollment? Yes, they will. This is not replacing online open enrollment. It's also not replacing employees' ability to just submit forms to Navia directly during open enrollment. Those options still exist. All this is changing is if you get sent, your employee says, here's my open enrollment form, and you want to send it to Navia, you're going to use the portal as opposed to maybe emailing or faxing it like you would have done in the past. Um, what are the other file types from that drop menu on a send a file page, which I just showed you guys? Basically, those are some other options that are used by non-PEB employers. They're just not really relevant to the PEB plan at this time. So just make sure you're only using that enrollment change in status or termination forms option from the drop menu. Uh, if you pick a different type, it's not like the form will get totally lost. It's not the end of the world, but it will help things flow a little smoother. It will definitely make sure the form gets processed faster if you do select that correct file type. Will the PEB billing still be handled by HCA? Yes, Navia and HCA is still going to be we'll be in communication about employee enrollments and changes in terms. So HCA still knows what to bill for, but basically there's not going to be any process changes or anything like that for the billing. This is purely really just a way for you guys to send Navia your enrollment forms for the FSA and DCAP. And then lastly, can BAs see employees' basic enrollment information in the portal? And answer to that right now is no. Like I said, really just a way to upload the forms, but that is being looked at as a future possible enhancement. It's just not currently available. So, and then another question actually had occurred to me as we were going through it. There were several of you who may actually already have access to the portal. We did do a couple of rounds of user testing. So if you have access and maybe another coworker at your agency doesn't have their access yet, the reason for that was just that you were a tester. So they will get their access as part of this rollout. If they don't have Azure, if they need a guest access, they will get that email on the 19th or the 22nd, and then they will be able to get in beginning on the 23rd. And that is it. That is it for the presentation. I've just got Navia's contact information up, so you guys are welcome to email us or give us a call. The email address isesteam4@naviabenefits.com. I do recommend email. It's probably going to be the best way to get a quick response, but you can also call us and receive a call back. The phone number is 425-452-3488. And we are open Monday through Friday between 7 a.m. and 5 p.m. Pacific time. And that is it for the presentation portion. So yeah, Christy, I'm just going to go ahead and leave the contact info up on my shared screen, and if I need to navigate back. So if you just want to read me questions.
Yeah. So first one is, are all BAs for Benefits 24/7 getting the user registration invite?
Um, the answer to that, I believe, is no. I believe HCA had reached out to each of the agencies over the last few months and received a list of authorized contacts essentially who need access specifically for FSA and DCAP. So if there were up to three contacts per agency provided who would get that access. So it's not just going to be everybody who has access and benefits 24/7.
Okay, thank you. Then somebody's asking, is it helpful to indicate the agency number in the notes when submitting a file? Or,
Yes.
okay, sorry, go ahead.
Oh, oh no, I was going to say absolutely. However, what would be even better is to write it on the form. There is a field on definitely the main enrollment form, but I believe most of them for agency. So, I mean, you could certainly put it in the notes as well, but putting it on the form itself would be best.
Okay, and then what about how many checks they'll get that year?
The number of payrolls. Again, I would indicate that more on the form than in the notes.
Okay, perfect. All right. Then, if we have multiple people in the same agency that has access to create an Azure account, is that okay for two or three people to go into the same agency account? Or do we have to use one Azure account with one username and password for all of us?
You can have multiple people at the same agency using their own Azure access. We just ask that you cap it at three people per agency.
Uh, is it best to have the BAs contact the HCA and the ES team for at naviabenefits.com email to gain access prior to 7/23?
No. So I apologize. I realized I forgot to mention that, but everyone who's basically in this webinar, you all are essentially pre-set up to have this access. So anyone who's going to gain access for the go live date of the 23rd, you all should be set and good to go. But after the 23rd, going forward, if you do, yeah, you have someone new you hire that you need to get added on, then you would need to go through those steps by contacting Navia and HCA.
Okay. And then, excuse me, we upload a monthly Excel file that indicates the funds withheld per payroll/individual. Is that uploaded on this site?
No, so the what we call the payroll reporting, where you're letting us know, yeah, what was taken in payroll deductions, whatever method you have been using to send Navia that information, please continue to use that method. This is purely for the enrollment forms.
All right, then that's it.
Okay, awesome. All right, well, I will go ahead and stop sharing.